Honourable Member for Renfrew-Nipissing-Pembroke.
Madam Speaker, last week I asked the Liberals when they'd end their cruel travel ban on those Canadians this government has branded as unacceptable. In response, the Minister of Transportation completed a Liberal hat trick, 3 misleading statements and 1 answer is a feat only a Liberal could be proud of. His first misleading statement was another attempt to play wedge politics with COVID shots. The Liberal Party desperately wants to import American politics into Canada. They've won fewer votes than the Conservatives in the last 5 out of 6 elections. They know they can't beat our party, so they try and pretend they're running against a different party with different policies. The minister knows everyone in this chamber has had at least 2 COVID shots, and no one in this chamber has spoken against the shots. The minister should apologize for this, but he won't. He swallowed too much of his own hubris. When the Liberals decided to politicize COVID shots, they began to believe their own talking points. They forgot COVID shots are a means to an end, not the end of itself. The minister next misled Canadians when he claimed they're doing whatever they can to protect Canadians. This from a government that initially told people not to wear masks because it would increase the chance of eye injuries. From a government which called anyone racist for suggesting the border be closed. Finally, his third misleading hit. The minister claims he's just following the science. This is perhaps the most grievous example of disinformation being pushed by the government. This government has been taking the name of science in vain for 2 years. They intentionally conflate the science behind the developing and testing of COVID shots with a political policy of banning people from boarding planes and trains. The challenge this government has is that it can't even get its science right. Prior to dropping the most pre-arrival testing for fully inoculated Canadians, there was a requirement to show up with either a recent negative test or, and this is key, a positive test result from the previous 180 days. So, Canada Border Service Agency seems to understand that proof of previous infection lowers the risk of transmission. Maybe somebody there could explain it to the Ministry of Transportation. Now, while the courts have found limiting the transmission of COVID allows for reasonable restrictions, they still must follow Section 1 of the test laid out by the court. If the goal is to limit the spread, the government must prove this policy is related to the goal of limiting the spread and not a punitive measure for those who won't comply with the Prime Minister's dictates, which goes to the heart of the question. Why is the Prime Minister's test for acceptability whether or not someone has had 2 COVID shots and not immunity? While COVID shots may be the safest way to achieve an immune response, they're not the only way. After firing people from their jobs, denying them social assistance, and calling them every name in the Liberal handbook, some Canadians still haven't gotten the jab. Clearly, no amount of coercion or duress will work. If the Liberals truly, honestly, actually believe their own rhetoric about protecting Canadians, they'd move to an immunity-based approach to risk management. That they still haven't shifted, based on the latest scientific evidence, proves they care more about punishing a small minority than protecting the vast majority. I challenge the parliamentary secretary to ignore his department-drafted talking points and honestly tell Canadians how this policy is still reasonable after all we've learned about the science of waning immunity.
The Honourable Parliamentary Secretary to the Minister of Health and the Minister of Sport.
Thank you very much, Madam Speaker. It's a sincere privilege to be here in the House for a late show, and since I know that the member from Renfrew-Nipissing-Pembroke has strong connections to the Dutch community in her riding, I'd like to say to her, Happy Dutch Liberation Day, and also say hello to my dad, Joe, whose family arrived here on October 15th, 1953, and we're very, very proud of our Dutch heritage, and I know they are in Renfrew County as well. Madam Speaker, while provinces and territories are easing public health measures, we know that COVID-19 continues to circulate in Canada. Throughout the pandemic, our government has taken clear and decisive actions to ensure the safety and security of Canada's transportation system, its employees, and its users. Federal vaccine mandates were implemented in the fall of 2021 for federally regulated air, rail, and marine transportation sectors to pursue key objectives, including to ensure the safety and security of the transportation system, passengers and transportation employees, and the public, delivering protection from infection and severity of illnesses and workplaces for all travelers. Second, to increase uptake for better and broader societal protection. And third, to play a leadership role in protecting the health and safety of our workplaces, our communities, and all Canadians. La vaccination est le...
Vaccination is one of the most effective tools that we have to fight the pandemic and protect our transportation network. It is important for Canadians to be up to date on their vaccines and that they receive a booster dose when eligible. That will help them to protect themselves and others from serious infection. Vaccination is an important layer of protection. And although being vaccinated doesn't give one complete immunity to infection, it does prevent people from falling very sick. And it can also reduce potential hospitalization needs.
From recent weeks show that across the country, unvaccinated individuals are still 3 times more likely to be hospitalized than individuals vaccinated with 2 doses, and they are 6 times more likely to be hospitalized than those who have received an additional booster dose. The incentive for vaccines is clear. It protects us from severe illness, and it lessens the burden on our healthcare systems. We need to take into account several factors when considering vaccine mandates. This includes the global and domestic epidemiological situation and the benefits and longer-term consequences of these measures. We continue to monitor the emerging evidence around vaccine effectiveness and the spread and the impact of COVID-19 in Canada to inform our vaccination strategy. In the meantime, Madam Speaker, we know that multiple layers of protection, including vaccination, protect against severe health outcomes from COVID-19. Getting as many Canadians vaccinated and boosted as possible and continuing to adhere to individual public health measures is expected to help us get through this phase of uncertainty and support Canada in managing COVID-19. Thank you. Merci.
The honourable member for Renfrew-Nipissing-Pembroke.
Madam Speaker, sadly, the Parliamentary Secretary did not take me up on my offer to speak honestly and directly with Canadians. Instead, we received talking points which clearly ignore the challenge the government has in justifying a cruel, inhumane, and blatantly unconstitutional travel ban on Canadians whom this Prime Minister has labelled as unacceptable. The member even managed to make the same misleading claims as the Minister. Through the Speaker, to the member opposite, no, you're not following the science, you're engaged in politics. This ban is clearly unconstitutional because there is a less restrictive policy available. Rather than discriminate on the basis of COVID shot status, the government could follow the science on the basis of immunity. I say could because I doubt they'll do something that politically unpopular. At the end of the day, the only thing that matters to this government is protecting its electoral ambitions.